Hello, my name is Holly Sinengo, and I've created this video to teach everyone the importance of mental health. Some things that people don't realize are how closely mental health and physical health are connected. A lot of the time, you'll see, your primary doctor for your physical well-being and then go and see like a psychiatrist or a therapist for your mental health. Well, both of those things are connected. And while it can be beneficiary to see people whose specialty is either the physical body or your mental health, it is also very important to realize the connection that the two have and just understand why both of them are important and why it's important to take care of your mental health. So the first thing that I wanted to mention is that according to the National Institute of Mental Health, 1 in 5 Americans suffer from a mental illness. While 1 in 5, which is about 20% of the population of people, suffer from mental illness, according to their statistics, women were slightly more at risk than men to suffer from this. Another point that's very important to note is that when it comes to patients who have mental illness in this country, while 20% have it, less than half, roughly 47% are actually actively seeking treatment for this. Why is it that with such a high number of people suffering from mental illness in this country that we only have about half seeking treatment? Well, there can be some things that make it difficult for people to seek treatment, and we'll go over that later in the video. Currently, in the United States, one of the biggest problems and one of the biggest things that we have negatively impacting people's mental health was the coronavirus pandemic. Now, according to the Institute of Mental Health, during COVID-19, many people started experiencing either new onset symptoms or discovered that their previous symptoms had gotten worse. This, of course, was seen even more frequently when they were talking to patients who had lost a loved one due to COVID or from some circumstance coming from that. Some of the mental illnesses that came about, which were new onset for some of these patients, were things like depression, anxiety, PTSD, and these kind of things that were kind of worsened by people being indoors or feeling isolated, especially during lockdown from, during 2020 when the pandemic first happened. So that was something that has caused a big spike in mental illness in the last few years in this country and probably all over the world. The data I have is just specific to America, but one could assume that if it's going on here, other people across the globe are also dealing with these problems. According to the National Institute of Mental Health, there was also an increased risk of suicide among African Americans specifically. And that's something that I think does need to be addressed. And also to make sure that we are providing the African American community with the resources that they need to combat that. One of the things that I wanted to touch on was how much power the mental health care system has, especially like in Western culture and in America. Previously, religion was kind of the standard for morality, and people looked up to religious leaders to see how they should act, how they should behave, what was considered acceptable behavior versus not acceptable behavior. And oftentimes, this was substantiated by religious texts. One of the things that has happened now with science and with the increase in people kind of turning away from religion and turning towards science and things that can be explained is that now healthcare has kind of become the new religion. Where, I mean, if you look at a doctor, let's just say, look at this example, a patient who goes to a doctor and receives a new diagnosis of being schizophrenic or something like that, that can have connotations, and it can also have consequences for that patient. So the provider, just in putting these labels on patients, is kind of redefining them in terms of how society sees them and how they see themselves. I read an essay called How Health Became the New Morality, and the author was talking about just this. And it was saying how, despite people being so caught up in healthcare, and we've been spending recently per person more per year than we ever have investing in our healthcare, we're still seeing increases in obesity and depression, which is kind of a contradiction, and it doesn't really make sense, because if we're spending more money and we're focusing more on healthcare, why is it that it's almost as if our health is declining? It really made me start thinking about whether or not the current system is really doing benefit for people, or if it's kind of turned into more of a power struggle. And you, on one side, you have the healthcare system, the mental health care and physical healthcare system that wields so much influence and so much control over people. And on the other side, you have patients saying, hey, like, you know, maybe I have this diagnosis, but I don't feel sick, or I don't feel like there's something that's wrong with me inherently. And it creates this kind of imbalance in healthcare, and it makes it hard for patients to follow the advice of practitioners because, for lack of a better term, they don't trust them. Some patients are also concerned that if they open up to health providers, that they will be forced to take medication that they don't want to take against their will, or be hospitalized against their will even. And that just further disrupts the patient and provider trust. Another thing that's come to light that's kind of made people move away from trusting, you know, pharmaceutical companies and healthcare providers is something I read about in an article from the Journal of Medical Humanities. That article was called Selling Sanity. The author talked about how the popular antidepressant drug Prozac was marketed to women back in like the 1950s, 1960s as helping them to become better mothers. You would have a woman who was experiencing depression or just was unhappy with her life, and she would see these advertisements saying like, it would be a woman saying, I take Prozac and now I can play with my kids again. And things like this to guilt women into feeling, though, as if they didn't take this medication, they were less of a mother, which is absurd. But it also goes to show you just how much power the healthcare industry has, where they can get approval to do direct to consumer advertising and influence people's decisions and the medications that they take based on what they're selling with this medication. Because it's not just the medication that they're selling, it's the disease as well. And this can also lead to people being weary of taking these medications, or some people, when they see this, they feel maybe a little manipulated, and that can prevent people from getting the help that they need too, which is a shame, because mental health care is so important, and having proper access to mental health care is also important. Some of the obstacles that people face, according to the American Psychological Association, that they face when it comes to either getting help or getting the correct help, is some people feel as if they can manage their symptoms better by themselves. Some people don't know where to access these services. Their insurance won't pay for it, or just the social stigma that comes with some of the previously mentioned diagnoses. When it comes to insurances not wanting to pay for drugs, according to the Office of Inspector General, they did a study, and it said that just with Medicare Advantage, just that insurance, that about 13% of prior authorization requests were denied due to things that they saw were like input errors. So they knew that the error was not consequential, and they still chose to deny it. And with Medicare, people who typically receive Medicare are elderly individuals. So this is an already at-risk group who really relies on these services and relies on their insurance paying for things, because many can't work anymore. So when people can't get their medication, it makes it really hard for them to take care of their mental health, because they can't afford the out-of-pocket cost, and it turns into an access problem. Another problem that we see when it comes to people getting the help that they need, the mental health care help that they need, is stigma. And according to the Journal of Social Science and Medicine, during the 1990s, many welfare programs were cut, and it led to a rise in people with mental illness becoming homeless, which is crazy if you think about it, but it's true. This led hospitals and jails to start filling up with mentally ill people who had nowhere else to go, who were either being held in jail on like trespassing charges, disturbing the peace charges, things that are kind of just racketed up to control someone. Also, hospitals and forced hospitalizations increased, which was a shame, because these people who had a mental illness still were not getting the care that they needed that enabled them to live a full life and a satisfying life. Some good things that are going on. I know that's like a ton of really depressing information, but there is some hope. And there are some things now that are being done to help provide service and make sure that people have access to services. Some of those things are task sharing, which is a practice that has started in rural medicine, but I think has great applications for the urban environment as well. Task sharing is where practitioners give out responsibilities and education and stuff to like nurses, community leaders, and they help share that load associated with caring for a mentally ill patient. So this means involving the community, having, professionals who they can call, or having people there to support them. A great example of this, I think that would be great for urban areas, especially because of how many immigrants we have, and sometimes not all providers speak the languages that those immigrants need in order to receive proper mental health care, is involving like religious leaders and family members and medical staff, actually explaining to them things, in layman's terms, but also so that they can be aware of the symptoms and be aware of how to best help their family and their friends. I think that if this is, implemented more, that translation service becomes less of a problem. Like if you go to a provider, and let's say that this particular patient can't speak English, but they can bring that family friend, or they can bring that religious leader with them to kind of help to translate and help with the cultural nuances as well. I think that's huge, and I think that would be really beneficial, not just in rural settings, but also in urban settings. Another thing that's really great that is going on in mental health care right now, according to Forbes magazine, there's a lot of new technology for mental health care. Things like prescription video games, AI and smartphone assisted therapy, applications for virtual reality. These things, they all have great promise moving forward, being able, especially like with younger patients, to kind of integrate technology into mental health care. I think that's also going to be huge moving forward in providing access and helping people to realize the importance of mental health and be able to follow up on it. The last thing that I wanted to talk about when it came to access and patients' rights is the Mad Pride movement. The Mad Pride movement is an activist group that advocates against forced hospitalizations and seeks to help patients get their power back from the system. They use peaceful protests to help bring about change. And I think that what they're doing right now in helping patients to advocate for themselves is huge. I think it's really important. And I just want to qualify that I'm not saying that I think all providers are bad or all, that everyone's power hungry. That's not what I'm saying. What I am saying is that our mental health care system in this country is broken and that we need to actively improve it. One of those things is giving patients the power to advocate for themselves and to have access to these resources. There shouldn't be like gatekeeping. There shouldn't be just here, take this medicine because I'm a doctor and I told you. No, patients should feel involved and they should feel like they can be proud of that involvement and have independence in that. So I think that is moving forward the key, the absolute key to accessing mental health services is advocating for yourself. And while it is incredibly true that there are not enough providers, that it can be hard to find a provider that you're comfortable with, it is really important to put in that work. And, if you can't do it yourself, get a family member, get a friend, reach out to your insurance company. If you have a therapist and it's not going well, I had a situation like that. Get a new therapist. Don't give up. Never give up and never stop advocating for yourself, because physical health and mental health are connected. We are body, mind, and spirit, and a holistic approach to healthcare is the only approach.